employment discrimination would investigate on a complaint basis. So if an employee comes in or a group of employees comes in and files a complaint, the Office of Civil Rights would conduct an investigation. In cases where they determined there had been a violation of the paid sick leave ordinance, so someone had not been offered leave that it was required, they would they'd make findings to that effect, formal findings, and they then sit down with the employer and try to work out a reconciliation. And the essential goal of that is restitution for the employees and then a correction of practices going forward. The ordinance does not include a schedule of fines for violation. It's really about fixing things. If OCR, Office of Civil Rights, fails to come up with a cooperative agreement with the employer, there is a process for them to then bring a case to the hearing examiner, and which is a city, essentially, administrative judge, and have the hearing examiner make a ruling and potentially order the kind of restitution and correction that I just described. So that's the primary enforcement path and the one that's anticipated that will be used. San Francisco has a complaint-based system. It's a somewhat different one. And interestingly, they're not actually receiving that many complaints, order of magnitude of 5 to 7 a month. There is, in addition, though, a right of private action. So an individual employee who is aggrieved or feels they've been aggrieved can pursue an action in court. They have to go to superior court. The municipal court doesn't have jurisdiction over such matters. At a practical level, that's a high threshold, and it's one that's unlikely to be pursued by an individual. So I think the Office of Civil Rights is the effective enforcement mechanism for the ordinance. Last subject I wanted to talk on was implementation. So there's some important provisions there. One is that the ordinance, as structured, has an initial 6-month delay before any of its conditions would take effect. The goal there is to provide an opportunity for the Office of Civil Rights to conduct some education and outreach, as well as to refine administrative rules, but to get the word out about what the ordinance entails. Then after that 6 months, Tier 3, the larger employers, the ordinance will come into effect for. For Tier 1 and Tier 2 employers, there's an additional, essentially, 6-month delay. So for the small and medium-sized companies, the ordinance wouldn't take effect until a year after its approval by the council, to provide an opportunity for transition, people to realign their benefits if that's necessary, but also just for general education. In addition, there is what I describe as a startup exemption for small and medium-sized companies. So small and medium-sized companies, for the first 2 years that they are operational, so from the point that they begin, for the first 2 years, they would be exempt from the terms of the ordinance. And then a last point on implementation. As it's now structured, the rules would take effect again 6 months or a year in. To the extent that there is an existing collective bargaining agreement, this ordinance would layer on top. So if you had a union agreement negotiated between an employer and a union that provided for less paid leave, this would layer on top and require that the employer step up to the new level of the benefit. So that's what I have, and with that, I'm going to turn it back to Deborah Brandt to introduce the panel.
Thank you, Ben. Before we get started with the panel discussion, I would like to do a little bit of house cleaning here. I'd like to thank Specialties for providing refreshments and the Seattle Center for hosting us. So if we could give them a round of applause for that. Given that employers want to keep their valued employees and that employees want to stay home when sick or caring for a sick family member without fear of losing their jobs, our goal tonight is a balanced educational forum on how Seattle's paid sick leave ordinance will affect us. We're fortunate to have perspectives on both sides of the issue, allowing us to address concerns from employers while addressing the ordinance's goal of ensuring that Seattle's workplaces are healthy and family-friendly places in which to work. Let me introduce our panelists tonight. Marilyn Watkins is the Policy Director of the Economic Opportunity Institute. Carl Gibson is Director of the Washington Policy Council. Jody Hall is owner of Cupcake Royale. David Black is the Legislative Director for the Seattle Society for Human Resource Management, and he's an attorney with Jackson Lewis, LLP. Robin Fleming, a registered nurse and school nurse at Franklin High School. And Stephen Springer, owner of several H&R Block franchises and board member of the Seattle Opera and Bailey Boucher. So as you can see, we have well-rounded representation here tonight. To begin, I would ask each panelist to make a 2-minute opening statement. We'll begin with Marilyn. I have a little timer, so if you start to go over, I'll just start beating on the podium.
Do you want me to come up or just do it?
No, go right here, right there.
Okay. Can people hear me okay? Yeah. Okay. So a couple of years ago when the H1N1 epidemic was gaining ground, we heard the message repeatedly, if you're sick, stay home. If your child is sick, keep your child home from school. That advice was easy for the 60% or so of the workforce that has paid sick leave to follow, but it was not so easy for the other 40%. There are about 190,000 people, we estimate, who work within the city of Seattle who don't get a single day of paid sick leave. And there are others who do get some paid sick leave, but face harsh penalties at work if they take it that prevent them from using it when they're sick. Unfortunately, it's most often people who handle our food and have a lot of direct contact with the public who don't get any paid sick leave at all. There was an article in the Journal of Food Protection recently that reported that 20% of food service workers admitted coming to work with vomiting or diarrhea in the past year. That's probably why, according to the Centers for Disease Control, that 1 out of every 6 Americans gets sick from food every year. And while 84% of the highest earners in our country do have paid sick leave, only 20% of the lowest earners get paid sick leave. So this is a social justice issue as well. We have lots of data from years of study by economists, HR professionals, and the government showing that the majority of businesses that do provide paid sick leave do it because it pays off in greater productivity and loyalty, less turnover, and better business. For me, this is a personal issue as well. My 80-year-old mother has metastatic breast cancer. The chemotherapy that's extending her life also makes her more susceptible to disease. I don't want the quality of her remaining life to be diminished because she gets sick when she goes to the grocery store or out to dinner. We have policy models from other cities that have successfully implemented paid sick leave standards. Over 70 organizations have come together in the Seattle Coalition for a Healthy Workforce. And it was a real pleasure to work with Jody Hall and other small business owners here in our city in crafting a policy proposal specific to the city of Seattle. All of us here are here today because we care about our city. We want vibrant neighborhoods with thriving businesses. Paid sick leave promotes worker health, community health, and business health. We've gotten as far as we're going to go with voluntary standards. Seattle has a reputation as being a national leader, and we can also be a leader in adopting paid sick leave standards.
Okay, thank you. Carl Gibson, Director of the Washington Policy Council. Carl?
Well, thank you, and thanks for everybody for coming here today to talk about this important subject. And I just want to dive right into some of the concerns that I have with this ordinance. And, you know, Marilyn talked about, we've gone as far as we can go with voluntary measures. But this simply is, there's incentivized benefits, and then there's imposed benefits. And this is an imposed benefit. There's all stick and no carrot with this ordinance. Concern number 2, there is a little bit of flexibility on the shift swapping, but there's very little flexibility, I mean, overall, generally speaking, for the majority of the businesses that will be impacted by this. And let's face it, every single business in the city of Seattle will be impacted. I see a couple of small business owners here whose business is located outside of Seattle, but they do business inside of Seattle. Your business is going to be impacted as well. Concern number 3, there is no economic impact study about this. And maybe this is my cynical nature, but if you don't do a cost-benefit analysis of an ordinance or a mandate, something like this shows to me, anyway, that you don't care about the cost. You only care about the benefit. And I think David's going to go into this a little bit more. But that's not a good public policy approach in my estimation. You have to take a look at the benefits. Do the benefits outweigh the costs? And we simply don't know. And Marilyn cites a bunch of studies that says yes. I could cite probably just as many studies that say no. But let's get to the bottom of it. And the last one, actually I kind of already mentioned it, but out-of-city businesses will be impacted by this. It provides yet another disincentive to do business in the city of Seattle if you're not located here. I think it's going to cost